Happy Friday.
Happy Friday to you also.
Well, good afternoon, everyone. Thank you for joining us. Oh, hold on a second. Wait till Dr. Antone gets sat down. Thank you for joining us for this briefing with regard to what the state is doing to slow the spread of coronavirus in Nebraska. And we have a number of different items today, so we'll jump right in. But of course, as always, we want to remind people about our 6 rules to keep Nebraska healthy. First, stay home. Don't take any unnecessary trips outside of the household, and please respect the 10-person rule. We also have Mother's Day coming up, and we'll have some more to talk about that. But we want people to, again, keep those limited celebrations to 10 people or less. Second rule, make sure when you're working in a socially distanced way. Work from home if you can. We had a question last night on NET about an employer wanting somebody to come back from working from home. Again, we'd ask employers, please continue to have people work at home if it's possible in your workplace to do that. That's still a good idea to have people work from home. So please help people do that. Number 3, I want you to shop, but only shop once a week. Again, don't take the whole family with you when you go shopping. Be efficient. Go to the store, get back. Want to make it one of those things where we're not giving the opportunity for the virus to spread. 4, help kids socially distance by keeping them at home to play, avoid group sports, and to make sure that you are you're avoiding the playground. There's also been some questions about team sport activities. There are no organized team sport activities allowed in Nebraska during the month of May. So there's been some confusion out there about that. Obviously, if there's businesses that sell memberships and they bring somebody in to do coaching, that's different, but no organized team sports in the month of May. Then we also, number 5, want to help seniors to be able to socially distance. And that means you can find opportunities to run errands for them, maybe do their shopping for them so they can stay home, but do not go visit them in a long-term care facility. And I know, again, with Mother's Day coming up this weekend, that it's going to be tough on families, but please do not go to those long-term care facilities this weekend. Those facilities cannot allow the relatives in. I know you want to see your loved ones, but again, we're still trying to protect that at-risk population by keeping them isolated. So please help us take care of those folks. As we discussed yesterday, if you look at the number of fatalities we've had here in our state, a lot of them are related back to, actually 2/3 of them are related back to the long-term care facilities. Again, the reason we're doing all these rules and all the social distancing, the 10-person rule, the 6 feet distance between people and all that, is to make sure we slow the spread of the virus and preserve our hospital system. And we've been successful in doing that. When you look at the hospital data, and that's again out there on our public dashboard, you'll see that we've got 47% of our hospital beds are available, 43% of our ICU beds are available, and 75% of our ventilators are available. So we've got that capacity in the hospital system. The social distancing steps we have done have worked to make sure we can provide everybody that hospital bed, that ICU bed, that ventilator when they need it. So it's worked. Continue to keep it up. Also, please want to sign up for testnebraska.com if you have not already. Testnebraska.com. Go sign up. Assessment takes less than 5 minutes. You'll be asked a number of questions. It is easy to do. The data is kept totally secure in our database. It's encrypted, not sold to anybody, not given to law enforcement, just used for this testing program. You can help us get the word out by challenging 5 of your friends with the hashtag TestNebraskaChallenge. Let's make this go viral so we get people signed up all across the state to be able to help take this test. We did the soft launch for testnebraska.com on Monday in Omaha and Grand Island. We have done 730 tests through yesterday. 1,730 tests through yesterday. We did 465 tests specifically yesterday. So in the 4 days, it was 1,730. Yesterday was 465. 968 tests have come back. 30 of those tests have come back positive. So for those of you who are really following along at home, you probably understand that's a lower percentage rate than what we're testing with our highly at-risk groups. So again, remember, we're prioritizing healthcare workers, first responders, food processing, that kind of thing, as well as people who have symptoms. And so this is a lower rate, but we expect that because we're testing in our other areas, places where we specifically know we have hotspots as primary place where we're doing a lot of our testing. So we expect to have a lower rate because this is a more general population. So again, we want people to sign up. And if you look at our first couple days, we've had not quite 80% of the tests get turned around in 2 days or less in that 48-hour period, which is our goal. So almost 80%. We did have some issues with regard to the procedure when we put it in place on Monday, so we got a little, some of the tests didn't get processed as quickly as we would have liked there. But I think we're, again, getting the process worked out, and so we're getting those tests turned around. So please continue to sign up for testnebraska.com. We are starting our next mobile testing site today here in Lincoln at the Lancaster Event Center. And again, these are by appointments only. That's why it's important to sign up for testnebraska.com. So we'll be launching Lincoln today, and we'll be launching Schuyler on Monday. So we'll have a fourth testnebraska.com set up in Schuyler on Monday. So continue to roll these out across the state and expand our testing capacity. And just in general, with regard to testing capacity, we have now tested over 1,500 tests per day for the last 9 days in a row. So if you just think back a few weeks ago, when we were hitting more like 700, 800 tests, now we've doubled that to about 1,500 tests per day over the last 9 days. And this Test Nebraska will continue to build upon that number of tests that we're doing around the state. In fact, I think we just crossed over 40,000 tests. Isn't that right? We just crossed over that last night, yesterday? 40,482. So over 40,000 tests now. So we have ramped up that testing capacity here in the state of Nebraska. So we have a couple of guests who are with us today. John Hilgert, who's our Director for Veterans Affairs, and Jason Jackson, who is our Director for the Department of Administrative Services, as well as my Chief Human Resources Officer. Memorial Day is coming up, and obviously we know we're still under the 10-person rule, and so we are not allowing large public gatherings. And of course, on Memorial Day, Nebraskans are very patriotic. We want to recognize our veterans. We want to remember our fallen heroes. And so we want to be able to recognize the sacrifices the men and women who put on that uniform have made for us. However, this year is going to be difficult to do that in the ways we've done that in the past with our gatherings in the parks and at our cemeteries and so forth. We're not going to be able to do that. The Legion Post won't be able to do that the way they've done in the past. We want to make sure that, again, we're not spreading the virus to these large groups. So what we're going to do is a unique event, still make it a special Memorial Day by having NET broadcast, with the help of John Hilgert and his team, a Memorial Day recognition in the Rotunda, a virtual Memorial Day, so that people can participate all across the state. It's one of our ways that we're going to be able to help recognize the sacrifices that those men and women have made, that their families have made, remember our fallen heroes, the people who died to be able to give us our freedoms, and do it in a way that will help slow the spread of the virus, help keep our fellow Nebraskans healthy and safe. And so I want to thank Director Hilgert for his work to be able to put this together. And so, John, I'm going to ask you to come up and talk a little bit more about this.
Thank you, Governor. Good afternoon. Yeah, it was not acceptable and certainly legitimate to maintain that distancing. So we were very concerned when Memorial Day started coming forward. We realized we're still going to be under restriction. But what's not acceptable is that we don't recognize Memorial Day. So we're starting our first virtual Memorial Day observance at 8 o'clock in the morning in the center of the Rotunda. And here's the vision. You will have a single, very large candle on a candlestick that will represent all of the fallen. Around that candle will be surrounded by flowers. In an arc behind the candle will be our service flags, our national flag, our state flag. And then at each end of the arc, you will have guard sentinels, one individual on each side, standing guard over this flame. The flame is to be lit at 8 o'clock in the morning. And Mel and Monica Alexander, whose son Matthew was killed in action on May 6, 2007, have agreed to light that flame, representing the families of all Nebraskans that have lost someone. That flame will continue until 8 o'clock that night, and then it will be extinguished again by the Alexanders. The guard sentinels will be changed out, if you will, every 30 minutes throughout the day. And in this way,
I can't hear you when you go over there, just so you know.
yes, sir. And in this way, all of Nebraska can participate, not only virtually, but we're going to have an online sign-up sheet. With that, Legion Club, the VFW, the DAV, all of those who participate regularly can send 2 members from their post. They will sign up, first come, first serve, for half-hour blocks, and that post, coming from anywhere in Nebraska, will be able to stand guard over that flame. So in this way, we broaden the participation, we keep our numbers down well below 10, and at the same time have that virtual online event that anyone across, well, actually the world, can turn into and reflect on the sacrifice of our fallen service members. All of our veterans' homes have annual observances that we were not going to be able to do this year. Almost all the nursing homes that I'm familiar with have some observance. In this way, you can incorporate this online vigil, if you will, this observance, into your local and your private observances. So I think it's been very warmly received. I first reached out to Hall County. They usually have a tremendous event. Talked to Mr. Don Schuda there. They canceled their event, and he said, "This is great, John. Thanks for supporting this." Also in Lancaster County, there's a lot of events going on in Lancaster County. I reached out to the city and the coordinator of their Veterans Committee, and they too are supportive of it. So we should have some participation from throughout the state. And I would encourage, as soon as this goes live, which I think, Holden, is today, they'll be able to sign up for this. When you sign up, you'll get more information about what door to go into and all of that. So we're very excited about that. The second thing that we'd like to announce too is today we're announcing our virtual veteran service officer. On March 23rd, the United States Department of Veterans Affairs Veterans Benefits Administration Regional Office on Old Cheney closed its doors to public access. So our service office that is co-located at that facility had to basically start working from home. No more traffic coming in and out. So what we have done, if you go to our veterans.nebraska.gov, our website basically, in the lower right-hand corner, you will be able to see an icon, and you can chat in real time with a state service officer that's fully accredited. And one thing I really like about this chat is that there's a name on who you're talking to, and it's a real name. It's not Bobby and Courtney that, generally when you chat online with different businesses and so forth, they have this generic. This is an actual name, so you can keep track of who you spoke to. You can coordinate with this service office to upload all your data, to apply for veterans benefits, to check the status. We have had this up informally, and we've tested it with a few veterans and with some USVA personnel, and we got all the bugs worked out, so it should work very, very well. And the real neat thing about this, and this is going to post-COVID Nebraska, is that we're going to start this now. It starts at 8 o'clock in the morning, and it ends at 8 o'clock at night. We're going to go and break that conventional 9 to 5, 8 to 5 office hours Monday through Friday so that, working people, veterans don't have to take vacation time to access their benefits. They can go home, have dinner, get online, talk to a state service officer. And sir, I think we're going to continue this well after COVID. So this is one of the ways we're looking forward. The last thing I would be remiss not to mention is today is May 8th. 75 years ago today, the Germans surrendered. Victory in Europe. So the 144,000 Nebraskans that were deployed, the 2,500 approximately that still remain, I want to say congratulations, celebrate VE Day. This is your victory. This is your day. Dad brought this back from Germany. He was a World War II veteran, so I got that out last night. And today I'm thinking of him. And I encourage all Nebraskans to think of their family members that served in World War II, the sacrifice, either deployed or at home, on the home front. And also tying in with Memorial Day, the 3,000 Nebraskans that never came back from World War II. So thank you, Governor, and thank you all.
All right, so this is a little risky, John, because we didn't talk about this ahead of time, so, but I'm going to test you, I'm going to quiz you.
Uh-oh.
The last fatality
Yes.
of the European campaign was actually Nebraskan.
Yes, I can't remember the name, sir.
Oh, I was going to say, if you can remember, I remember it's from Dorchester, and
Dorchester?
yeah, why am I dropping his name too? I'm dropping his name too. We should have practiced this ahead of time.
That's right. I remember even going to the ceremony because they had a storm that night. We had to drive around.
Yeah.
Holden
sure.
Armstrong will probably do.
Holden will get the answer. This is how we're going to do it. We're going to do it as a quiz.
Yes.
And so we'll come back at the end of the program then with the answer. Right, Holden? Eddie?
You can raise Taylor,
And-
so we can see who's staff.
Okay, so Holden's gonna get it for us. Thank you. Holden's gonna do it. One of the other things we do here at the state of Nebraska, Eric, do you have it already?
The governor needs the answer.
Yeah.
He thought.
Charlie Havlick, that's it. Thank you very much. Charlie Havlick, thank you very much. Thank you very much, Eric. So, there you go.
And his family is originally from Czechoslovakia too, so
Yeah.
it's interesting that.
And his family's from Czechoslovakia originally, yeah. Great. So, again, one of the things we try to do here at the state of Nebraska is create an environment that is safe, productive, and positive. So we recognize the contributions that our families make. Back in 2017, I signed into law a preference to hiring the spouses of military and active duty military here in the state of Nebraska, just like we offer that preference to our veterans. And also, we've been working to make the state of Nebraska a more friendly place for families through our maternity leave donation program. So, for example, if you're one of our state teammates, you can loan your unused leave to an expectant mother so she can take more time off. And in fact, we've had about 134 of our teammates benefit from this to the tune of about 11,000 hours. So that's one example of how we've done that. We also have a number of different things we're going to be doing to be able to be even more family friendly, like extending preferred parking to our expectant mothers, having mothers' rooms for nursing mothers, piloting a program with regard to families in the workplace, and a number of other things. And we thought with Mother's Day coming up this weekend, it'd be a great time for us to announce the programs that we've got and what's going on with regard to how we're making the state of Nebraska more family-friendly. And so Jason Jackson is going to come up and talk a little bit more in detail about our programs for that. So Jason, would you please join us?
Thank you, Governor Ricketts. And as the governor said, it is Mother's Day, so it's appropriate that we acknowledge all of our mothers in state government. And it's exciting to take this opportunity to announce some new initiatives that are going to continue to make Nebraska a foremost employer for women and for families. And that's been a priority of this administration, as the governor has said. And so to that end, it's our desire that we make sure that we're coming alongside and supporting all of our teammates as they're starting their families and growing their families. In particular, we know that women make up 54% of our workforce in state government and face unique challenges when it comes to family formation and childbirth and returning to the workplace. And so with these initiatives, what we're hoping to do is come alongside our parents in state government, and women in particular, through their maternity experience and their childbirth experience, and ultimately their return to work experience, so that they can continue their careers in public service with the support of the state as an employer. So we have 4 initiatives in particular that we're announcing today. The first of which is an initiative to make sure all state buildings administered by the Department of Administrative Services, greater than 5,000 square feet, have nursing mothers' rooms. Again, this is a challenge that new moms face as they return to the workforce, and if they're nursing, that they be accommodated with a place that's private, that has running water, flat surfaces, comfortable seating, refrigeration, so that they can go through that nursing experience and be supported while they're returning to the workplace. So that's one of our foremost initiatives that we're announcing today. Secondly, we're enriching our primary wellness and benefits program to reduce the cost of maternity and delivery care by 75%. So going forward in the next plan year, in our Well Nebraska plan, families and moms will face an out-of-pocket maximum of just $500 for maternity and delivery care associated with their growing family. Third, as the governor mentioned, we're starting a preferred parking program for expectant and new moms. Expectant moms can now sign up through the Department of Administrative Services to get preferred parking for up to a year after the point in which they sign up, to really make it easier on them in terms of arriving and coming to and from their workplace. And then finally, within the Department of Administrative Services specifically, we're announcing a pilot today that'll begin next week, in which we're calling our Babies and Our Kids at Work program. So we're going to enable parents to bring their babies and their children into the workplace and work alongside parent as they're returning to the workforce after childbirth. We know, again, that this is another unique challenge that moms in particular, but families generally face as they contemplate their return to work and continuing their career as their families grow, is, hey, at that 6-week mark when, I'm starting to face that my leave is exhausted and I'm thinking about, hey, what's my childcare solution for my new baby? We want to accommodate that and come alongside mom and dad and enable them to bring baby or child into the workplace so that they can continue their career, get back to work, and just really make it easier for them to contemplate continuing their career and continuing their profession as their families are growing. Again, that'll be a pilot at DAS specifically. We're excited about how innovative it is, but there are other states that have done this. So in particular, we've benchmarked with states like Washington, Arizona, Kansas, New Hampshire, and several others. And we're excited to see what we learn at DAS and if there's an opportunity to expand it broader, statewide. So again, collectively, these 4 initiatives represent a continuation of Governor Ricketts' leadership in really trying to make sure the state of Nebraska as an employer is family-friendly, that we support families, that we support moms and dads, and really make sure that we're a family-friendly employer and that people can continue their careers in public service as their families are starting and growing. So with that, I'll turn it back over to Governor Ricketts. Thank you, sir.
Great. Thank you, Jason. Okay, so we got a number of other things we want to hit upon here before we get into questions and answers. First, new guidance coming out. We made the announcement. Okay, actually, we're going to take a step back here a second. So again, changes to our DHM. You can see, again, the dark blue counties. These are the ones that, effective this week, May 4th, have the new DHM, which allows for restaurants to open at 50% capacity, that you can have salons and barbershops, tattoo parlors, massage therapy, all operating back underneath, again, the 10-person rule with the restrictions and so forth. The light blue ones are the ones that will take effect on Monday. Those counties, that will be the same DHM, just extended, or just starting on May 11th. And then in the green counties, we've got those that are currently going to May 31st. So one of the things we talked about, again, with those salons and barbershops is coming out with guidance. So we're working on that guidance. You can expect to see that come out shortly with regard to how those salons and barbershops and so forth, tattoo parlors, massage therapy will be able to, that guidance coming from the state about how they should operate. Second thing that kind of relates to that is PPE requests, so personal protective equipment. The state is purchasing personal protective equipment. We've talked about how much we've purchased and how much we've distributed. Again, we get a lot of questions about this, so I thought I'd just go over and clarify it, is that we are prioritizing those folks that are in healthcare or first responders for that PPE. So if you're a facility that is hospital, a long-term care facility, clinic, something like that, that's going to be high priority. We are also providing PPE to our public health departments for their use. So anything that's going to be along the lines of that healthcare, protecting people first, first responders, law enforcement, EMT, volunteer fire departments, all those people protecting us, healthcare workers, are going to get the priority with regard to how the state is distributing PPE. We're also doing it for other professions as well, like our corrections officers and utility workers and so forth, that are also part of, an important part of keeping our state running. Now, others have requested that, and in the healthcare area, we will be considering that for things like dentistry and ophthalmology and so forth. There'll be, we'll consider it for those professions as well. And then we have had folks like salons and so forth request PPE, but we're not providing those to private institutions outside of the healthcare industry. We will connect people to be able to try and find their own, but generally those organizations are going to be responsible for acquiring their own PPE. So again, as we put out guidance to salons and so forth, they're going to be responsible for getting their own PPE. The state is not going to be providing that. So just want to be clear that the state is providing PPE to those healthcare people who are protecting us, that kind of group of people, but not to private companies who need to acquire their own PPE. Also, want to talk about PPP, the Payroll Protection Program, not to be confused with PPE. This is the program from the SBA that Nebraska was very successful the first time around. Our community bankers worked with our small businesses. Over 80% of our small business payroll was covered. We were the #1 state in the nation because of the hard work of our community bankers to be able to make that happen. That program ran out of money. Congress has put more money back into that. And so that program is back out there for small businesses to work with their bankers. It is also available for rural hospitals. And so this is one of the questions we've been asked about. The SBA is doing a webinar on this. So if you are a rural hospital in Nebraska, the SBA is going to be doing a webinar. Please go to their website and check it out. But you'll be able to get more information about how you as a rural hospital can apply for the payroll protection program. Okay, I think we hit upon all the things that I was going to hit upon, and now we'll go into questions and answers. Okay, Aaron Grace, Omaha World Herald. One Rural Community Health Center is asking for state backup in South Omaha. Will the state consider setting up test sites in North and South Omaha? And, well, first of all, we are, testnebraska.com is at the CHI Health Center Arena. So that's one of our sites we've got set up. And we are also working with Charles Drew and One World on expanding testing there as well, along with working with Dr. Adipur on that. So we are working on expanding that testing with other sites, as well as working with those two organizations directly about how we can do more testing for our communities in North and South Omaha. So yes. Her second question, why not mandate reporting from meat packing plants to public health officials? So again, I want to take a step back with regard to the meat processing facilities. Actually, we've been asked a question yesterday about the deaths, so let's update on that. We have had 3 fatalities in our food processing, meat processing industry since the beginning of the coronavirus epidemic, and that's out of 1,104 total cases where we've confirmed that the person is tested positive and works for the facility. So again, Aaron, just to be clear, when somebody tests positive, employment information is not necessarily part of what they report what they need to do to get a test, okay? And we don't report that information back to the company. So companies don't necessarily know if somebody is tested positive or not. It's up to the person to report that to the company, or the person to report that to our public health department. And so that's why the state is only reporting aggregate data, because we're only going to report it aggregately across the state and not for individual facilities, because guess what? Sometimes people don't tell the truth. We've had a number of cases where somebody said, I tested positive and I work for this company, except they didn't work for that company. Or we've had other cases where people have tested positive and did not say that they worked for a company when they did work for a company. So we are not releasing, what we are releasing is aggregate data, just like I just released to you, for industries like our food processing industry or the long-term care facilities, but we're not going to release on a per-company data from the state standpoint. Now, what we've issued guidance to local public health departments, if they want to do that, what they need to do is, again, confirm that the person actually works for whatever company that they're going to be releasing it for, and work with the company to do that so that you can actually have accurate information. But again, because there's the HIPAA laws with regard to when we get somebody tested positive, we contact the public health department, the local public health department, so they can do contact tracing. Part of their contact tracing will be find out where have you been so that we can let those people know. But we don't tell the company that information, so companies don't do it. So we could mandate companies report that, except they don't have that information because they're not a part of that information chain. So I think there's a kind of a misunderstanding about how this whole process works with regard to what companies know when somebody gets tested positive. And it's really that public health department is doing the contact tracing, not the company. Paul Hamill, Omaha World Herald, if gatherings are held at private venues, are gatherings of more than 10 people permissible? Nope, the answer is no. The 10-person rule is the 10-person rule for any gathering that we've got here in the state of Nebraska, unless we've made a specific exception like we've had for houses of worship or restaurants. So no, a private venue is not allowed to have more than 10 people. What about rotating people in and out of, say, no more than 10 people that are there at any one time? So again, if you've got a private venue and you're rotating people in and out, I suppose technically that is within the letter of the law, but it's not the spirit of the law, because when you're rotating people in and out, what you're doing is you're creating more opportunity for the virus to spread. So that is not something we would recommend. Henry Cordes, Omaha World Herald. Do you feel we have peaked in the state? If not, are there other thoughts on when the state might peak? Well, one of the things, if you look at some of the models have changed constantly. So like one of the models a lot of people worked at is IHME. That's the Washington State model. I've looked at that model from time to time as well. At one point it showed we were going to peak April 23rd. Now I think it's moved back into May. So those models keep changing. So really they're not very good. And as Dr. Kahn would tell you, models aren't really predictive. So I don't really think about it with regard to when the cases peak so much as what is happening to the hospital system like we've described. Making sure we've got that hospital capacity in our hospital system to be able to take care of people when they come and seek that hospital help. So that's really what we're focused on. And again, the reason I'm focused on so much on that is because that doesn't change whether or not somebody tests positive or not. If you are sick enough to go to the hospital, you're going to go to the hospital whether you think you've got coronavirus or not. Whether you get tested positive or not, you're going to show up at the hospital. And so that is a concrete number that we know doesn't change with testing. People are sick or they're not, and they go to the hospital. So that's a really good concrete measure that we can look at that will tell us how the hospital system is doing, and which is really the goal of what we're trying to accomplish, is keep that hospital system available for everybody who needs it. Testing, on the other hand, is a variable that changes all the time. It changes based upon how many people we test, and it changes on who we test. So for example, when we're testing less symptomatic people, we get lower test rates. Maybe 3% of the people are testing positive. When we test higher risk populations, we can get much higher percentage of people testing positive, like what we saw in Lexington when we had 30 or 40% of the people test positive. So you can change that variable based upon who you test. You can also change the number of cases that you get based upon how many people you test, right? So the more tests we do, the more tests we're going to come back positive, right? We're going to find more people that are positive. Now, that's not the only reason why we're going to get more cases test positive, but that's one of the reasons why when we test more, we're going to get more people who test positive, so we're going to see our cases go up. If you think about the opposite, we could stop testing and our case count would drop to 0, but that wouldn't change the fact that virus is still spreading in our state, right? So again, you can see case count's not necessarily a good thing to measure, because if you stop testing, you get 0 cases, but we still know virus will be spreading in our state, so that isn't really reflecting reality either. So that's why looking at case counts by themselves isn't really a very helpful thing to look at, and especially when our big focus is about how we're protecting and preserving the healthcare system. That's what we really care about. When asked about new daily highs, earlier this week, you twice cited, I think I answered this, twice cited increased testing. Are you suggesting substantial increases in cases we've seen are merely a function of increased testing? No, I'm not saying it's merely a function, but I am trying to draw out that there is a correlation that the more you test, the more you will get positive tests back because you're testing more people. Should people in Nebraska be concerned to see new daily highs right as we are beginning to reopen? So again, I want to go back to our analogy of the speed limit. We could end nearly all deaths on the interstate highway system if we took the speed limit down to 5 miles an hour. But we don't do that. But essentially, if you want to think about it this way, we've done that for our society by all the restrictions we've put in place. Now, we did that for a good reason, right? We wanted to make sure that the healthcare system didn't get overwhelmed. And we didn't know how this was all going to spread. There was a lot of unknowns. So we took some pretty dramatic steps to be able to slow down the spread of virus here in Nebraska. All these restrictions we put in place, the 10-person rule, the social distancing we're doing, some of the businesses we closed and so forth. And it worked. It totally worked. We slowed down the spread of virus. We flattened that curve so that that peak did not overwhelm our healthcare system. So it totally worked. We kept the integrity of our healthcare system. Everybody who needed that hospital bed or that ventilator was able to get it. So now what we see is that we've got plenty of capacity in our healthcare system, and we're trying to find what is that right speed to be able to allow people to return to a more normal life. Again, we're only slowing the spread of virus here in the state. We can't stop it. It's a virus. We can't stop it, but we can slow the spread, and we've done that. So now we're trying to see what sorts of restrictions can we loosen so that we can allow people to get back to a more normal way of life. And so that's what we're in the phase of right now, is starting to loosen some of these restrictions, like we did starting earlier this week on May 4th, or what we've done with elective surgeries, worship services, allowing restaurants to go back to 50% capacity. These are all steps along the way of slowly releasing some of these restrictions so that we can get back to a more normal way of life, understanding that we're going to be managing this virus for a long time, at least the balance of this year, until there's a vaccine that works, and there's no guarantee that that will happen. So we got to really focus on managing this virus, which means that we've got to take these social distancing measures. We're going to continue doing this throughout the course of the rest of the year. So we got to figure out what is the right speed to be able to manage that here within our state. And that's what we're working on right now, is really focusing on what is the best speed. So we're just going to continue to focus on the healthcare system and make sure that is available as kind of that benchmark, that variable that does not change whether or not we're testing or not. So Grant Schulte, Associated Press. Has there been any discussion about using the National Guard to help staff polling sites on Tuesday in an area with a shortage of poll workers? So the Secretary of State has done a number of scenario plannings that the National Guard has been included as some of those alternatives. So everything has been discussed and is on the table. So we've done a number of scenario plannings. Taylor.
Hope from the Seward County Independent wants to know the timeline for opening pools this summer.
Hope from the
Seward County Independent.
Seward County Independent wants to know when the timeline is for opening up swimming pools. I've actually had a number of discussions with our mayors and board chairs, village board chairs across the state with regard to swimming pools. We at the state will be coming out with some guidelines with regard to that. Later this month, we want to see how this month goes along, then have some idea about the data as we talk about how those swimming pools might reopening. But again, for the time being, we know that a lot of pools open up on Memorial Day. 10-person rule if you're going to do it, so no more than 10 people there at any one given time. And as I've talked about that rule, most mayors have said that probably doesn't make it worth the while to open up those pools, and I certainly endorse that. So, we got to think about how many people, we got that 10-person rule and limit. Could that be relaxed in June? That might be. And that would then apply to pools as well, but there's not a specific guideline on when pools can reopen. And so we're going to I would say, stay tuned as we get more data. The state will have some guidelines with regard to that.
Maya from KMCB would like to know about, with the lodging program, are college dorms being used, who's using them, and has this been offered to meatpacking workers?
Maya at KMTP wants to know, are college dorms being used for lodging, and who's using them, and are food processing facility workers being allowed to use them? And the answer is yes to all those. So starting today, the University of Nebraska-Lincoln will be available. UNO and UNK have already been available, I believe. Dr. Antor, do you have the numbers right offhand? Because I know we've got at least one person at UNK, obviously nobody at UNL right now, because we just opened up today.
UNO is up to 24.
UNO is up to 24, and I know we got 43.
Responders, I think, are up to 43, I think.
Well, that's, actually, I think we got food processors are 43.
Take,
Yeah.
meat processing people that are allowed to go back and forth to work, but the 43
Yeah.
in hotels.
So the answer is yes, we do have, so we're using, for example, some hotels for, our meat processing workers who are going back and forth to work. So we got 43 of those folks in hotels. And then we've got, of course, our first responders who are using some of the hotels around the state as well.
Don Wolf wants to know, do you think ongoing social distancing means that Husker football, at least without fans, is unlikely this fall?
So Don Walton wants to know if I think Husker football is going to be unlikely this fall. So I would say that I think that it is something that we should start taking a look at. And I know this is going to be a conversation that I'm not going to be directly involved with, but this will be NCAA, this is going to be University of Nebraska. But I think actually under certain conditions, we could see Husker football this fall. Now, that may mean the season is delayed. It's certainly not going to look the same way it was last year. It's not going to be like the old football games. But could there be fans participating in a way? Yeah, I think there could. Could everybody be, for example, be wearing masks and that kind of thing? I think there's an opportunity to be able to make that happen. But it's really, a lot is going to depend on what the NCAA wants to do, what the individual schools are want to do, and it may not be every school. For example, I can imagine Rutgers in New Jersey is going to have a hard time, or a lot harder time than we will here in Nebraska.
Paul Hamill wants to know if you have any response to Rachel Maddow falsely claiming the state was not releasing information about nursing homes and package plants.
So Paul Hamill wants to know if I have any reaction to Rachel Maddow falsely claiming we hadn't released information. She clearly hadn't been watching our press conferences because I proactively released information with regard to our food processors yesterday. Yeah, what she said was just factually wrong. She's just wrong. And, she's got her own agenda, and I guess that's about it.
Can you, he also wants to know why corrections officers don't have that 95 masks.
So Paul wants to know why corrections officers do not have N95 masks. Again, we are masking folks in our facilities. They've got PPE. We're doing that as part of our overall program. And I think that part of it is with the N95 masks, it's just difficult to do their jobs in those because they're heavier. So I think we've got, is that the regular, I'd have to get Director Frakes to either surgical masks or the cloth mask, but I think that the N95 masks are just difficult to do really heavy physical work in. So, but you know what? Why don't we get Director Frakes to get a direct answer on that?
And then David Earl wants to know about testing. Are we ever going to get to a point where anyone who wants a test can get a test, maybe even multiple times in a month?
David Earl wants to know, with regard to testing, will we ever get to the point where anybody who wants a test can get a test, maybe even multiple times a month? And certainly that is one of the possibilities we may have down the road. It'll just depend on how testing capacity ramps up across the nation with regard to reagents and the production of reagents and all the other testing materials that we do. But right now, we've got lots of capacity here in the state of Nebraska. Again, people need to sign up, testnebraska.com. We have lots of capacity to be able to do testing, so please have people sign up, get scheduled, get in. We got lots of capacity.
And then we just have time for a couple of questions in the room because your local health director's call is actually supposed to start now.
Oh, geez, I'm late for my, I've been talking too much. Okay, so we'll just take a couple of questions from the audience here.
I had a question in regards
Yeah, Lee.
to the thing coming up on Monday, if I could ask it here. Obviously, it's hard for folks to not be able to do their typical Memorial Day services for their fallen family members, heroes, that kind of thing. Can you kind of talk about how difficult it is for folks not to be able to participate in their normal agendas, but to be able to then be able to watch and participate in something like this? What does this offer to those folks?
Well, first of all, it is Monday, May 25th. It's a few weeks out, so we have a time for, please sign up, those honor guard members that would like to be sentinels. No, I think that this whole thing is difficult. I think it's difficult when you miss a birthday. I think it's difficult when you can't go to a religious ceremony. I think it's difficult when you can't graduate from high school. My son's graduating from the University of Nebraska tomorrow. I think that's difficult. But one of the things that what we do is we try to do what we can. And in this situation, with Memorial Day, as a state observance, we were able to do something. So this is what we were able to do, and I think it's something that's very valid, and I think it should, not really fully replace, because it's something very different, but I think that'll fill a need. At any time during the day, you're going to be able to see this flame, this presentation that is being guarded and honored by these sentinels, this flame that has been lit by a Gold Star family, and you're going to be able to take time out of your day to do what you normally do on Memorial Days, remember the fallen. So I think that that fills a need, but it is something that we can do. But this is just one of many things that people are having difficulty with. But our Department of Veterans Affairs wanted to step up and do what we can.
Thank you, John.
Just 2 more questions.
Yep. Martha, go ahead.
Governor, what are you doing to look at the state budget? And are you giving any instructions to state agencies about what they should be doing, given the uncertainties and with how much revenue the state will have?
Yeah, so the question is, what are we doing about our state budget and the uncertainties with regard to what revenues are going to look like? And yeah, we are starting to make those preparations with regard to, again, what are we going to be doing to make sure we're being able to continue to provide our services, constrain our spending, and so forth. And some of it, again, we're just going to need to see what happens over the course of the next couple of months. You know, for example, the revenues that we had from March were released in mid-April. Well, those didn't really reflect the full impact of what happened. We'll have another release of revenues here in about a week or so that will have April numbers, and that will give us a little bit more information. So part of it is, Martha, before we can make some more specific plans, we really have to get a couple more months under our belt to see what the impacts to the revenue is going to be. We know there'll be an impact. We know, for example, that about $330 million in payments got moved from April into July, so that's going to impact our cash flow. That certainly impacts what's going to happen this fiscal year. But I would also remind people that as we were going through March, we were about $296 million ahead of forecast from the forecast that was set last July. So last July, we set a forecast. That's what we used for the 2-year planning cycle and so forth. That was the certified forecast. And we were $296 million ahead of that forecast as we're going through March. So, and we had a healthy cash reserve. We had a healthy cash balance. I think our cash reserve in March was our cash balance, think about that kind of like our checking account, was at $583 million. Our cash reserve was at $488 million. So we had over $1 billion in cash available to us because we were running ahead of our forecast. So, in part because we were running ahead of our forecast. So we're in a very strong financial position. So we want to see exactly what's going to happen over the next couple of months. But you're absolutely right. We are going to have to be doing some planning with regard to what are our expenses we're going to be constraining, what expenses, what are we going to do to adjust to the new reality of what the impact on the budget is going to be. We just don't have a good idea of what that is quite yet.
Time for one last question.
Great. One last question?
Do you attribute the lower positive rate from Test Nebraska entirely to geography?
Do we attribute the lower than the other test, the test positive being roughly 3%, being lower than what we've been testing in other places to geography? Actually, the geography is Omaha and Grand Island, so it's not a geography thing. It's really that one of the groups we prioritized were healthcare workers, first responders, food processors, and so forth, but not necessarily people who were symptomatic. So again, people who worked with people who may have been exposed to the virus, but not necessarily showing symptoms. So I think that's actually the reason why we're seeing a lower percent positive rate.
Are you saying that there's different priorities for Test Nebraska than for the other testing that's going on?
Right. That's exactly right, Fred. So for example, with Test Nebraska, what we said was, right, we're going to test first responders, healthcare workers, food processors, law enforcement as a priority, the groups of people keeping us safe, and then highly symptomatic people, and so forth. In other areas, what we've done is we've gone in places where we know we've got spread of the virus and testing high-risk groups there that we know we've got lots of spread of the virus versus just having anybody who signed up in the Omaha area, for example, to be able to come in and get that test. So they are testing different groups. And again, that's kind of why I say looking at percent positives is a key indicator when you may have spread in your community, but it can be also not a great thing because depending on who you test, you're going to get different testing positives. The Test Nebraska really demonstrates that with 3% of the people testing positive with the group of Test Nebraska versus some of our other places where, you know, again, I'll use Lexington as an example, when we started testing there and getting 30% positive there. So again, who you test makes a difference on the percent positive. And so if you're testing people who are not symptomatic, you're going to get people who generally test less positive. So,
Are we, do we have enough tests for the people that, have been in the group that were testing, the ones who have the symptoms, the ones who are at the 30%?
yeah, absolutely. So again, we've been testing, in that group, we've been testing about 1,500 tests a day, which is up almost double from where it was just a few weeks ago. So we've greatly expanded that testing as well. So not only are we expanding with Test Nebraska, but we're also expanding with our current program of how we were testing people too.
We expanded enough.
We have got lots of capacity in the system, Martha. So absolutely, we've got more. We want to continue to expand capacity, but we are able to do the testing we're doing and expand testing as well. All right, folks. Well, again, thank you very much. Appreciate it. I want to say Happy Mother's Day to all the mothers out there. Thank you to all the Nebraskans who are working to slow the spread of virus here in the state. Everybody have a great weekend. We will see you back here next week. Thank you.